You have to decide what's important, and that could be minimizing deaths. It could be minimizing the spread of infection. It could be minimizing social disruption or shoring up your health system. All of those things are obviously crucially important, but they all involve vaccinating different groups or prioritizing different groups when you've got a scarce vaccine. So there are some really difficult questions that need to be answered before you can make those decisions about who gets it first.
Lots of difficult questions, which I hope I'll ask you, and I hope you would answer them. Because, I mean, one argument goes that health workers are at the front of this vaccination program. I mean, it makes sense, doesn't it, for health workers to be vaccinated first?
Yeah, absolutely it does. It makes sense because they are at risk of becoming ill themselves. They're at risk of spreading illness. And also they've been working incredibly hard, or depending where they are, but under really difficult circumstances. And I think there's a sort of measure of reciprocity that's involved as well. We want healthcare workers to show up to work and work as hard as they can under these horrible, horrible circumstances they're working under. And I think we owe them something in return for that.
For governments, this is the toughest question of all. Some governments say, OK, it's the elderly must come first. Certainly the UK government, the different categories, the over 70s, 80s, 90s, most at risk. Other governments have decided, OK, the economies the economy of this country is so badly affected, we need to vaccinate the workforce. What kind of ethical decision-making comes into play there?
It's very common when you're talking about public health ethics, certainly, to think about what's going to benefit the greatest number of people. In a non-COVID situation, it would probably involve vaccinating in such a way that you knew that you were going to reduce the spread of infection. And so the kinds of decisions that we make around vaccination more broadly and that we're used to making around vaccination about protecting everybody and protecting the largest number of people might not be the same calculus when it comes to COVID. So you mentioned the UK government vaccinating the elderly. That is in order to minimise the number of COVID deaths, and that's a very reasonable thing to do, of course. There's no correct answer, and I can't give you an answer, I'm sorry.
It is almost unanswerable, isn't it?
It really is, right?
But I was hoping you would be able to answer it. But which governments around the world do you think have got it right so far?
I think the New Zealand government did an amazing job. The Australian government has done very well also. It's been at some cost, the national borders are closed. A lot of the state borders have been closed on and off. The hotel quarantine system is very tough, but it's very effective. We've done an amazing job here with contact tracing, especially in New South Wales, where I'm based. So really, I'm very grateful at the moment to be in the situation that we're in.
We're seeing in Europe and the UK something which is being dubbed vaccine wars breaking out. A general unfairness about the distribution of vaccines. I mean, we're supposed to be living in a time of globalization. That's gone away, hasn't it?
Completely agree with you. I think that's something that we've seen in the last 12 months has been very much every person for themselves or every country for themselves, depending on how you want to look at it. There have been some really great attempts to try and hold that at bay. The COVAX agreement, if you like, is supposed to try to make equitable vaccine distribution, which will really help all of us. I hope very much that that's going to work, but there doesn't seem to be much sharing, shall we say. And of course, not every country has the same capacity to access vaccine.
You talk about Australia and New Zealand successfully flattening the curve. Do they now have a responsibility to help other less developed countries with their vaccination programs?
Yeah, I believe we do, certainly. As far as I know, Australia's certainly made a commitment to do that with neighbours in the Pacific Islands to help them get protected. Because if we don't, I mean, I don't know when they will have the capacity to get vaccine.
Dr. Jane Williams, many thanks to you for joining us here on The Agenda.
Thanks very much for having me.